just want to highlight more on the value that 3D visualization and 3D modeling has added into the clinical space. But the first is, of course, offering a better surgical outcome and minimize complications on the way. So 71% of clinicals found that the virtual 3D model has improved their ability to manage potential post-op problems in surgery for congenital heart diseases. And there's been a 41% of shorter stays of DORV patients in the intensive care units when using 3D printing. Having a patient-specific 3D model can also help to plan critical clinical decisions more accurately. So there was an 8.5 out of 10 score given by surgeons involved in congenital heart operations for usefulness of 3D models in pre-op planning. And 66.7% of interviewed cardiac surgeons, cardiologists, and radiologists find patient-specific 3D models helpful in pre-op planning. It can also help to realize that you can treat patients who may have been previously untreatable or thought that they were previously untreatable. So there was a study done where after assessing 15 different patient CT scans, only 13 cases were consistent with real treatable options and 2 others were not. But with the addition of seeing an added perspective of 3D, they realized afterwards all of the 15 cases were consistent with real treatment options. And as I mentioned before, having a model, especially from the patient or the patient's family perspective, it allows them to really feel like they can give true informed consent. So 9.5 out of 10 average rating by parents for the usefulness of a 3D model when explaining the congenital heart disease of their child. And we can also even think about how it can improve communication between the surgical teams. So 92% of clinicians are moderately to highly satisfied with the ability of 3D models to enhance the understanding of the anatomy of patients' congenital heart defects.